Thank you, Speaker. This is a really frustrating debate. I'll agree with Councillor Matlow there. But what frustrates me is that I've just heard two speeches, one sort of against and one sort of in favor, and they're both wrong. The issue isn't whether you're against alcohol or for alcohol in parks. The issue is whether or not we're going to do it in a way that manages the harms. Dr. Davila, who is the expert here, not the people that Councillor Matlow cited, and the Canadian Addiction and Mental Health, who are literally the experts in North America, have all said over and over and over again, people will use drugs, they will use alcohol. The issue, like trying to stop them, is wrong and stupid. Saying that we should just throw it open and let everybody do it and forget about it is wrong and stupid. The issue is, are we building the systems to make it safe? And when Councillor Matlow brought his motion last year, I immediately sat down with the city manager, with the mayor's office, with the medical officer of health, and said, let's get to work on getting those supports in place and how it's all going to work. And we started that work through the drug strategy. And unfortunately, then the Omicron wave of the pandemic hit and staff got reassigned and we didn't make it for this time. That's why it's not ready. And I'm sorry, but we just at the beginning of the day, we had a big presentation to celebrate all the frontline workers who've been busy with the pandemic. Well, that's Toronto Public Health, and it's because of that they didn't get this work done. And if you're going to celebrate them, acknowledge that they've been too busy to get to some of the other things. Here's what we need to have in mind. Councillor Matlow has talked about this as a justice issue. It absolutely is a justice issue. Alcohol is the most harmful drug in our society, and the harms are disproportionate by low-income people, by racialized people, and by women. Half of all women attending university, when surveyed, will tell you they have been victims of sexual assault or harassment, and the majority of them will tell you that alcohol was involved. Centre for Addiction and Mental Health has pointed out that when the province of Ontario expanded access to alcohol without doing anything to increase treatment and supports, that the number of emergency room visits went up as a result of increased things like drunk driving. It is utterly possible for us to have people drink in the parks and not have those outcomes. But right now, if you're a low-income person and you're struggling with, heavy drinking or alcoholism or alcohol dependence, you cannot get access to treatment and supports in any kind of timely fashion. You just simply can't. We don't even have places to take people who are drunk and passed out on our streets other than emergency rooms and police stations. There are a few treatment beds, but it's not enough. The University Health Network tells us that a very small number of people consume a huge amount of time in emergency rooms at hospitals because we are not building in what the evidence tells us, which is to allow people to use drugs and alcohol, but to make sure that you're educating young people into how to do it in a way that's safe, that you're giving women the support and resources to make sure that they're not getting sexually harassed by drunk people, that you're providing treatment to low-income people who are struggling with alcohol dependence issues. Those are the things that you have to do to make these work. And we are literally halfway through a process of the drug and alcohol strategy to get that done. And what's frustrating to me is I've sat down with Councillor Matlow and pointed all of this out to him and asked him, can he time his work on this so that it comes together with a strategy that lets people drink in parks and do it in a way that doesn't generate harms. And he chose not to. That's also frustrating because it reinforces the false choice between legalizing and temperance, as if that were the issue. Anyone working in the field will tell you that the evidence says that's a false dichotomy, and it's about creating education, treatment, harm reduction resources.
Thank you, Councillor.